Hello everyone. Today my topic is related to maternity and it's related to a primary powers of labor. The labor can have a primary powers and secondary powers. The primary powers is when the uterine contracts involuntarily. Secondary powers are when the mother pushes during the contractions. So we will be discussing about the dilation, effacement and station. Before we go on to our topic, I will discuss about the uterus structure and I know you are already aware of this. So I want you to make a uterus diagram in your notebook and write it down the different parts of uterus. I'll give you few seconds. Okay, so this is a uterus. This part on the top is called fundus. These are fallopian tubes on both sides, ovary. This is a body of uterus and inside layer is called endometrium. If you see at the end of the uterus, you see this part. This is called cervix. This has an important role during the labor. These two structures on the sides are called the lips, the cervical lips. This parts opens at the time of contractions. This part is going to dilate and thin, and this is the vagina. Next, let's talk about effacement and dilation. Effacement and dilation happens at the time of uterine contraction. Effacement is a thinning of cervical wall and dilation is the opening of the cervix. If you look at these diagrams, in the first diagram is similar to the diagram we just discussed. If you see here, there is a cervical lips and this part is a vagina. There is no change here. It means there is no thinning, there is no dilation. So we'll say that there is a 0% effacement. I also want to tell you here the effacement is only measured in percentage and dilation is measured in centimeter. So if you see here, there is no dilation, there is no effacement. So there is a 0% effacement. If we go to the second diagram, we'll see there is some thinning has happened. And why those are happened? This is because the uterine contraction. So uterine contraction should cause effacement and dilation. So if you see that the thinning is happening and it's about 30%. So if you see that there is the cervix is gotten thinner by about 30%. If we go to this diagram at the bottom, the first diagram will see there is a complete thinning of the uterus. So it's complete thinning. So we call it 100% thinning. So it's 100% effacement. There is basically a very less dilation, maybe 1 centimeter or 2 centimeter. If we go to the last diagram, we'll also see the dilation. This is a complete dilation. There was already a thinning, 100% thinning, and now there is a complete dilation. Complete dilation is equal to 10 centimeter. And that is the time only after complete dilation the mother can use the secondary power. It means she can push at this time. You see that how the area has opened and it's so easy for the fetus to come out. You know, it's like a cylinder, like a open area. So now it's easily the fetus can come out, and that is the time she should push. She should not push voluntarily before 10 centimeter of dilation. The next I will like to talk about the station. When the presenting part is at the level of ischial spine of the pelvic cavity, we call it a zero station. Presenting part is engaged at this level. It means the presenting part cannot move up once it has reached to the zero level. It can only move downwards, not the upward. So when the presenting part moves 1 centimeter below the ischial spine, we call it's at +1 station. If it moves 2 centimeter below ischial spines, we call it's a +2 station. So all these three processes, effacement, dilation and station, happens because of the uterine contractions, and which is equal to labor. I really want you to do some questions here so that I will know that you understood the topic and you will also know that. So the first question is effacement is described in, you can choose one answer, whether it's described in centimeter or percentage. Yes, it is described in percentage. It's correct. I have a second question. The mother uses secondary powers after the cervix is 100% effaced. Is it true or false? The secondary power is when she pushes voluntarily, right? It is false because she only uses secondary powers only after it's 10 centimeter dilated. Okay. So now I am done with this topic here and I hope you understood this topic. If you have any question, either write it in the comments or send me a message. Thank you so much for listening my topic.